Hollowing of face and eyes after plastic surgery. What happened? I went to have my jowls refreshed. The surgery was repeated a second time with fat repositioning. Nothing. A third surgery was done, this time no fat repositioning. I was left with baggy skin by my temples, so a fourth surgery was done to correct the third surgery. I was told that the surgery was to correct baggy skin, came with no risk of looking different. 2 months later, my face is hollow. I look 20 years older and my eyes seem to sink in deeper every day and look smaller and smaller. What happened?
Thank you for your question. You've submitted 2 photos showing the full face and eyes, and one with your face turned a little bit. And you've described a series of surgical procedures that were meant to enhance the appearance of the face, and you feel at this point that you look older and that you have hollowing of the face and the eyes. So, you're asking what went wrong. Well, as a specialist, certainly I get to see a lot of people from all over the world who have issues with surgical outcomes, both for eyes as well as facelifts. However, it is very important to understand the context of what your situation is. In the absence of seeing your before pictures and knowing the full details of your subsequent surgeries, it's difficult to say exactly, quote, what went wrong, but if you went to a surgeon who is experienced and does this type of surgery routinely, then it may be more a function of how you healed and the intrinsic elasticity of the tissue. In surgery, we do things with a very specific intention, and when you do surgery for a long time, I've been practicing surgeon for over 20 years, and I've done thousands and thousands of surgical procedures, including eyelids and facelifting surgery. You have a certain amount of experience in the technical aspects, but then what also you experience is the range of individual variation. So someone like yourself, you may have an intrinsic laxity to your tissue, so that no matter where the surgeon is placing and doing what the surgeon feels is right for you, you may not get in your healing process the desired result. So I think that that might be the issue with the facial laxity and why things are stretching or appear loose. As far as the hollowing is concerned, that's a little bit difficult to say because, again, without comparing before pictures, I'm not sure what I would describe exactly as hollowing, unless you're referring to as the area of the side of the cheeks. I will comment a little bit about your eyes. Again, in the absence of your pre-op photos, I would just say that your lower eyelids appear a little bit rounded and a little bit low. And this is something we see commonly called, it can be labeled as lower eyelid retraction. Once again, I have to add the conditional statement that if your eyes looked like this before, then this is not necessarily an issue as a secondary effect of surgery. But with the lower eyelids, there is a little bit of more controllable aspects when compared to the sagging or stretching of the neck skin or even the lower facial skin. And so you may want to explore correction of the lower eyelid position if that is a significant change for you. If you want to get additional opinions, you really need to meet with doctors and get formal examination by qualified specialists. I would also state that you need to be cautious about physicians disparaging other physicians. This is unfortunately a time when There's a lot of interspecialty rivalry, and there is one particular group of surgeons, particularly general plastic surgeons, who essentially disparage anybody who is not a general plastic surgeon, and that is unfortunately very unprofessional, and to me is a red flag. When a doctor analyzes you and tries to give you an objective opinion about your appearance and what can be done, that's one thing. But if someone says that another doctor, quote, botched something, or they did something wrong, I always tell my patients who come to me that I wasn't there. I didn't know what your situation was at the time. So it's inappropriate for me to make that kind of statement. That's a personal opinion, but I think it's a good measure of the level of professionalism of the doctor. I think that you do, at this point, if you've had 4 surgeries from the same doctor and you feel like you're not getting the result you desire, it is completely reasonable to get additional opinions. And I think that communicating these additional opinions with your doctor is important. This is still the art of medicine, and one procedure, one size doesn't fit all, and getting some ideas to help guide your achieving your desired look is certainly your right to just move and try to attain more information, as you have through this method, that by submitting your photos. So I think that you should take your photos from before, review them with your surgeon, and try to get an understanding to the explanation of what transpired and what can be done. Your surgeon may want to reach out to other doctors to get additional opinions as well, and try to collaborate with you in order to get to achieve the desired look that you want. Nobody knows everything about everything, so it is part of medical care that doctors ask each other about unique situations and what would be a colleague's approach. So I hope you're able to achieve the final result that you're looking for, and I hope that was helpful. I wish you the best of luck. And thank you for your question.